I want to welcome you here this evening to our Magnet panel event. Thank you very much for coming to the nursing research poster event that we just had out in the hallway. Certainly was lovely to see a lot of our alumni and students and community members interacting over the wonderful research that we all do here. I just want to give you a little bit of an overview for this evening so you know how it's going to lay out for the remainder of the evening. I'm going to start off with our Dean, Linda Johnson, bringing brief greetings, and as well then we'll have remarks from Joe Mappa, the CEO of Sinai Health System, followed by remarks from Jane Merkley, who's the EVP and Chief Nursing Exec from Sinai Health System as well. Following that, at least by 6:30, maybe a little sooner, we will start off with our panel presentation. And the panel isn't using slides tonight, as is common with most of our panel presentations. Everybody is just going to speak to their perspectives on the magnet recognition that we're celebrating here tonight. We have Mary Agnes Bedouze, who is the Vice President, Professional Practice and Associate Chief Nurse Exec at Mount Sinai. It will be our first speaker, followed by Anne Sutherland-Bowell, who is the CEO of the Canadian Nurses Association. And then we have another special guest this evening, Donna Sullivan-Havens, who is the Interim Dean and a Professor at University of North Carolina, Chapel Hill. And she's actually the chair of the Magnet Credentialing Center of the Magnet Commission, who delivered the message to the Sinai Health System about receiving the designation this year. Following that, we will have questions from the audience and then adjourn. So just so you have a layout for what we're going to do, I'd like to start off by inviting our Dean, Linda Johnson, up to say a few words of welcome.
Thank you, Linda. It's both an honour and a pleasure to add my greetings to those of others at this significant event that explores the Magnet designation and its potential to advance the profession of nursing in Canada, and to celebrate with our friends and colleagues at Sinai Health System their designation in January 2015 as the first Magnet hospital in Canada. I have no doubt that everyone in this room, those participating via the concurrent webinar, and those who may be watching the video of this event at a later date, aspires to the highest excellence in nursing. But how to achieve that in an increasingly resource-constrained environment, with the multitude of competing demands that characterises healthcare today, is a challenge that takes us committed leadership from the board down, innovative, solution-focused ways of thinking from the point of care upwards, and an embedded culture that empowers nurses to deliver the highest standards of care. The Lawrence S. Bloomberg Faculty of Nursing is very proud to host this event as a demonstration of our partnership with Sinai Health System and our ongoing commitment to contributing to excellence in nursing research, education and practice within Canada and internationally. I know you'll join with me in welcoming our panel and our invited guests. Thank you.
Good evening, everyone. My name is Joseph Mappa. I'm CEO of Sinai Health System. Now, CEOs, I mean, they have a lot of ceremonial jobs. In this case, this is an unbelievable, profound pleasure because I see so many members of the Sinai Health System here. Faces at Mount Sinai Hospital, which is our site on University Avenue, faces from Bridgepoint Active Health, which of course is our site on that gorgeous facility on the DVD. And I don't know if anyone's here from Circle of Care at all, which is a home care organization. But they also have some nursing component there as well. Let me begin by saying something else. You mentioned Donna was the one who called at that Mount Sinai Hospital site to talk about the Magnet status a few months ago. And first of all, it's great to meet you in person, Donna. But if you can imagine a hall, an auditorium similar to this, full of about, I mean, packed. We were standing ovation, right, Mary Agnes? Standing ovation, 200 plus people. And there's a voice on the phone. And this, don't forget, is a culmination of 4 years of hard work, enthusiasm, anxiety, aspiration. And the voice said, "You are the first Canadian hospital to achieve Magnet status." I can tell you that a lot of us in the professions, Mary Agnes, myself, Jane, others who are part of the Sinai Health System in this room and elsewhere, the moment was, it was, I guess the word ecstasy is a very good word. And this was ecstatic for all of us. I mean, some of us are smiling, but it's true. People were going crazy. Do you remember that response, Donna? I mean, it was phenomenal. So thank you for your message. And we will try and we will work everything we can do to merit your confidence in Mount Sinai Hospital, Sinai Health System, as the first Magnet designation. Because we have a responsibility now, don't we? Yeah. People often ask me, and actually, before I continue, I just want to talk about the relationship between the Bloomberg Faculty of Nursing and Sinai Health System. It's a very close relationship, as you know. It goes many, many years. Close not only intellectually, but also emotionally in terms of our achievements, our milestones, what we do together, chairs, other relationships, students, of course, which is our principal mandate. But we also have another relationship. Lawrence Bloomberg, who's the nursing school is named after, it was the chair of Mount Sinai Hospital before it became Sinai Health System, evolved into that for about 10 years, not about 10 years. I was the CEO, he was the chair. And every great idea, doesn't matter what the idea is, has a catalyst. Someone says something, someone suggests something, someone inspires something, someone pushes something. Lawrence, who's an avid reader of New York Times and the Wall Street Journal, as I know very well, once, this goes back about 4 or 5 years, as I recall, came to my office, or we spoke on the phone, and says, he says, "Joseph, I saw an ad in the, I think it was New York Times at that time, about a hospital just achieved Magnet status. I think these hospitals, as Donna will tell you, advertise everywhere once they achieve it. It's a great brand magnet. It's a great reputational advantage. It's a great honor." And he said, "Why don't we think about, given the history of this organization, of the faculty and our Department of Nursing, and think about pursuing this important standard?" And that was the combustion. That started the whole process. And remember, at that time, Tracy Kitch was CNE. Actually, we spoke to her, she spoke to her team, and we took it on. And it's been a marvelous journey in so many ways, including the success of Magnet status. But also, the fact of the matter is, even if we had not received it, which I can't imagine, the fact of the matter is the process, the discipline, the rigor, the aspirations, the excitement, the motivation would be worth all of it. We grew, we learned, we became better as an organization. People often ask me, why Magnet? Why did you, Joseph Mappa, take on Lawrence's sort of inspiration? Why did you take it on as a mission with our team? And I think the reason I'm going to give you the answer is because it's probably analogous to many of the organizations you work in, because you're going to now start thinking about this. Your CEOs, your CNEs, your leadership teams, you're going to start thinking about it. And the reason is really very, very simple. The first reason is, Sinai, generally speaking, because there are other organizations as well, but Sinai is very ambitious for excellence. That's our history, that's our founding, that's our mantra. We are very ambitious of being excellence in what we do. So the pursuit of excellence is a very, very important part of our ethos and of our personality. So that's one reason. The other reason, and I think we have the evidence to show this, we're great believers. Our belief is that great nursing practice, excellent nursing practice, fuels excellent patient care. This has always been our philosophy, our commitment, our investment in the future, including Magnet. And that's an important philosophical takeoff point for all organizations. And thirdly, I was thinking about this. We are a life learner. What's the expression? We're lifelong learner. That's the expression. We are. And where you can learn and grow is something that we embrace. Magnet, with its standards, its principles, its philosophy, its reputational power, was the right vehicle to pursue in this context. It really was. It was really an intersection of our ethos, which I just described, and what you represent in North America. Only, I don't know the exact number, it's about 400, or less than 400 organizations in the States have this status. It is hugely significant when you think of how many organizations actually operate in North America. Hugely significant. So for us, that intersection and that chemistry worked, and we learned and we grew. And for us, it's also very important. As a CEO, I think about the future all the time. I never look at the past. I think the past are the lessons. The future is what my job is. And the fact of the matter is, as we build Sinai Health System, which is really a vision for integrated care, in our case, academic integrated care, in the pursuit of better patient care. And our partners are Mount Sinai Hospital, Bridgepoint Health, Circle of Care, and hopefully others in the future. This will be an anchor and an inspiration for the standard for the best patient care. So with that, and I'm sorry I can't stay, I got to go somewhere else at the University Affair tonight. I have to go. But I can't, and you're going to hear from Mary Agnes, who's going to talk about the journey, the ambition, and the achievement as well. And congratulations to you, Mary Agnes, as well for that. And you're going to hear about that. But what you're going to hear is a story that I encourage and challenge each of you to pursue, because excellence is worth it for our patients. Thank you very much. It is now my pleasure to introduce our Chief Nurse Executive, Executive Vice President, Patient Care Quality, and Chief Nurse Executive, Jane Merkley. Jane?
Thank you, Joseph. So it's not surprising with a CEO like Joseph that we were as successful, because, without leadership, the achievement of Magnet just doesn't happen. So good evening, everyone, and thanks for your warm welcome. And I'm, delighted to be here, and also to bring greetings on behalf of the Sinai Health System. And let me just start by saying how thrilled I am to be the new Executive Vice President and Chief Nurse for the Sinai Health System. It's an honor to be part of such an amazing organization, to work amongst great leaders like Mary Agnes Baduz and other colleagues that are in the audience, and Joseph. But this organization is known for its excellence and its clinical excellence and its professionalism. So it's just a privilege to be part of this organization, and also to be part of the university and the academic health sciences networks, who also shares the same vision and mandate for excellence in clinical care. So today is a recognition of a landmark of nursing excellence, and we are excited that all of you, both in the room and on the webinar, et cetera, are all part of the recognition of this landmark. And you're all part of it, and you're part of it because everyone in this room are stewards of the nursing profession in one way or another, and are committed to improving quality and the experience of care for the patients that we serve. And as stewards of the profession, we together have taken this accountability from those who have mentored us over the years, who have educated us in terms of what nursing looks like at its best. And in turn, we now have the obligation and accountability to impart what we know based on the evidence, and how best to advance new knowledge, new innovations in clinical care, and improvements in our profession to those who we mentor. And so in doing this, our mandate as nursing leaders in particular is to preserve the spirit and the essence of nursing, and the essence of the original vision of nursing as an art and a caring science, and establish rich academic and learning environments that really continually refine and cultivate our profession so that it remains centrally relevant to all the changing, with all the changing environment for our patients, our community, and for the system. So this is what Magnet is really all about. It's all about a roadmap for nursing professionalism and excellence in nursing service delivery. This is important and because the space that we operate in as nurses is a very privileged space. It's a sacred space in terms of, just that importance in terms of the relationship that we have with patients. And so because the relationship at the core unit is between a patient and a nurse is based on warranted trust, and that trust is based on the fundamental currency of professionalism, which is a very complicated and integrated process of the mastery of our knowledge, also our professional ideology, our identity, and all of those are attributes of scholarship, and that when enacted are truly forces of magnetism and nursing excellence. So as I've arrived just over 70 days ago, I think, as part of the new Sinai Health System team. And as you can imagine, as the new Chief Nurse Executive, I've been very keen to really understand the organization and the culture of the organization, how care is delivered, and also really what it meant to be and to be a hospital that has received Magnet designation. It's been certainly a rapid learning curve for me over the last few months, and I would say a real source of joy in terms of for me to do this as I'm learning, because I've met some wonderful colleagues, got to really connect with the frontline nursing team, and really understand what it means in terms of this Magnet designation at the front lines. And what's clear to me that Magnet's all about a very deliberate declaration of the central value of nursing, and a very intentional and professional way of pursuing excellence in nursing practice. And for me, it also includes a very effective way of stewarding the profession of nursing. And maximizing our impact on patients and clinical outcomes. So, and as Joe said, we are embarking as a new system that's about providing excellence in integrated health service delivery. And so certainly this Magnet designation is a solid foundation in terms of the change and transformation agenda ahead. So I hope you'll all join me in this celebration tonight, and that you'll become as inspired as I have around the vitality of nursing, and the value that the Magnet status brings to our profession, our care, and the mandates of our health system. So thank you, and I'll turn it over to Linda. Thank you.
Thank you, everybody, for those greetings from Linda and Joseph Mapa and Jane as well. So I'm going to turn it over to the panel now. As I said earlier, we'll start off with Mary Agnes Bedeuse, the VP Professional Practice and Associate Chief Nurse Executive at Mount Sinai Hospital, or Sinai Health System. I should just say the champion of Magnet. And she'll present her perspectives initially. Then we'll move to Anne Sutherland Bowl, our Chief Executive Officer of the Canadian Nurses Association, to bring her perspectives on Magnet and what it means to us here in Canada. And we'll wind up with Donna Sullivan-Havens from the University of North Carolina at Chapel Hill in the U.S., who's the chair of the Executive Committee for the American Nurses Credentialing Commission Center for Magnet Hospitals, okay? And following that, then we'll have some questions again. So, Mary Agnes, you're up.
Okay, thank you. Can you hear me? So thank you very much for those introductions, and in many ways I kind of feel like my talk's been given, so I can kind of relax, finish my wine, and listen to my colleagues on the panel. And I want to say thank you, Linda, for saying that I've been the magnet champion. And yes, I've been magnet's been in my portfolio since the beginning. But having said that, I think every nurse at Mount Sinai Hospital is a magnet champion. We all own this, and it certainly was a labor of everyone's effort. So I certainly don't take sole credit for it at all. So as you heard, on January 2015, the Mount Sinai Hospital site became the first hospital in Canada to receive the prestigious magnet designation. And I'm also very glad to meet Donna in person. The journey to achieve magnet status began about 5 years ago as the organization began to build a framework that reflected magnet principles. So for those of you who are not familiar with the magnet model, the magnet principles essentially fall into the categories of transformational leadership, structural empowerment, exemplary professional practice, new knowledge, innovation and improvements, and empirical outcomes. And so in a nutshell, the way I like to tell people about it, what it says is that if you have great leaders in an organization, those great leaders are going to work with direct care nurses to build structures and processes that will be based in and create exemplary professional practice. Those nurses will have access to new knowledge and innovation. They will result in great outcomes for patients, for nurses, and for the organization. And that, if I can say in a nutshell, is how I like to explain what the magnet model is about. Last summer, we filed a submission with the American Nurses Credentialing Center that included more than 3,000 pages of data outlining the role nurses play at Mount Sinai and the impact on patient care outcomes. And I want to emphasize the impact on patient care outcomes because that is what this is about. The journey to magnet designation culminated in a 3-day site visit, which 3 appraisers from the ANCC evaluated and validated all aspects of nursing care at Mount Sinai Hospital. Achieving magnet designation requires more than completing a submission and hosting a site visit, and I want to emphasize that because I think oftentimes people say, yep, great, let's pull down the paperwork, fill it out, and we're going to get the designation. It is a very rigorous and thorough evaluation of how nursing leaders with work with direct care nurses to create structures and processes that enable nurses to work in an environment that allows exemplary outcomes for nurses, for patients, for the organization, and for the healthcare system. Excellence in nursing, a passion for patient care became our tagline. It was a staff nurse in our labor and delivery unit who came up with the tagline, and it was selected by our frontline staff. And it became an expression of a deep-rooted belief and commitment in the pursuit of high-quality, safe, ethical, evidence-based, patient and family-centered care. It became the banner over which we were able to organize and come together. Being a magnet-designated hospital means that we must outperform the benchmark. The majority of time, the majority of the indicators, and the majority of our units that have been selected over a 2-year period. And so achieving this is not an easy feat, as we learned. The achievement was a challenge, particularly in Canada, because we don't have good ways to measure and compare the outcomes of our nursing practice. We can't do this within our healthcare system, not easily. One of our early challenges was to work with our decision support team to create and develop a nursing balance scorecard for our organization. We were able to use CIHI data sets and other provincial data sets to provide data at the unit level so that our direct care nurses could measure and use and improve the outcomes of their care. And for us, this was truly transformational. To have frontline staff who can talk about their outcomes in a very intelligent and purposeful way, and not only talk about their outcomes, but talk about how they're going to improve those outcomes of care using best evidence and practice in order to do so is truly, truly phenomenal. We have over 1,300 registered nurses at the Mount Sinai Hospital staff, and we represent 1/3 of our hospital employees. We perform over 16,000 surgeries a year. We have over 61,000 emergency visits and about 28,000 admissions. And nurses are involved with each of these encounters. With every patient and family, providing care, using their clinical knowledge and skills, and making a difference in patients' lives every day. But they don't work alone. And so one of the challenges around Magnet is that while it's all about nursing, it's not all about nursing. So one of the challenges is how do you create a nursing culture, a strong nursing culture in an interprofessional environment, not excluding our professional colleagues, but working with them and together with them to improve patient outcomes. We worked with our interprofessional team members to achieve amazing outcomes, and if I can share a few of those with you. Over the past 2 years, we've seen an 80% reduction in hospital-acquired pressure ulcers. We've seen 67% reduction in hospital-acquired urinary tract infections, 84% reduction in central venous catheter-associated bloodstream infections. We have a 0% ventilator-associated pneumonia rate. We have a 0% MRSA bacteremia rate. We have a 75% reduction in nurses' total work-related injuries. We outperform the OHA Employee Satisfaction Survey benchmarks in 9 out of 10 measures of nurse engagement. 94% of our physicians express high levels of satisfaction with the quality of nursing care. And most importantly, 96% of our patients are highly satisfied with the care that they receive at our organization. And my question is, how many of you can say that about your organizations? Not those numbers, but how many of you have those numbers at your fingertips that you can articulate how it is that you perform relative to those outcomes? So it's not that I believe that good care doesn't exist everywhere in our system. It does. But it's our ability to articulate that care and our role in achieving those outcomes that is crucially important. Achieving Magnet designation was truly an enterprise-wide effort from our board of directors, senior administrators, physicians, hospital staff, and our extraordinary nursing team. Everyone rose to the occasion. Magnet is an organizational designation. It is not just about nursing. I would be remiss if I didn't acknowledge the leadership and effort of our current Magnet Program Director, Maya Sino, and our Director of Nursing Education and Development, Natalie Palladot, who's here tonight, who contributed significantly to our success. But as I stated earlier, Mount Sinai began this journey 5 years ago, and without question, we are a better organization for having had the courage and ambition to pursue this designation. This has truly been a transformational journey. Our nurses have been changed by the pursuit and the achievement of this designation. When the Magnet appraisers were visiting with us, I had done a lot of work prior to that, but during the actual visit, I had a very small role. In fact, my role is negligible. Other than meeting with them the first day, they were let loose on the rest of the hospital, and I could just sit back and hope and pray that everything went well, although I was pretty confident that it would be a good outcome. At the end, when we did a debrief at the end of the 3 days, I remember one of them said to me, "When you get Magnet designation, you will be truly amazed by how transformational this is. You will not be able to stop your nurses. If you think you've come far now, wait until this happens." And I thought, oh, thank you very much. please tell us we're successful and let us know. But I have to say that even though it's been a couple of months, I'm already beginning to see her words come true in our organization. Recently, one of our graduate students who was with us from the University of Toronto is doing a placement with us, attended one of our coordinating council meetings, and she reflected that although she too feels that she works in a very highly functioning organization with good nurse involvement, she was amazed at the engagement of our direct care nurses and understanding their outcomes and their desire to improve the care that they deliver. Next week, like many organizations, we'll celebrate Nursing Week. And Nursing Week is typically a well-celebrated event at Mount Sinai, with the feature being our Nursing Recognition Award ceremony. Peers nominate peers for a variety of awards in clinical practice, education, research, and leadership. And we typically have anywhere from 5 to 20 nominations per category, and usually clinical practice and education are well represented, and leadership and research not so well represented. But this year, the enthusiasm of our nurses is remarkable. And for example, we've just had over 60 nominations for our Nursing Leadership Awards. And that's a record number for us, and just an example of the enthusiasm and commitment of our frontline staff. On a personal note, I'm very thankful for having had the opportunity to be part of this journey from the beginning. I'm grateful for working in an organization whose values I share and that supports nurses and nursing work, and one that's embraced the challenge to continue its proud tradition of pursuing excellence in patient family-centered care, education, and research. So I want to thank you all for coming here tonight and listening to me about our experience and the pursuit of magnet excellence.
Thank you very much. My name is Anne Sutherland Bowl, and I'm the CEO of the Canadian Nurses Association. And I'd like to welcome you all, but I'd like to acknowledge not only Mount Sinai, who's shown tremendous leadership, but also the University of Toronto, who is well known for knowledge translation, and this is a knowledge translation event. So thank you, because you are always there when there's something new and wonderful to share. So thank you. In terms of the opportunity for magnet hospitals, I really do see it as an opportunity. At the Canadian Nurses Association, we often communicate with policy decision makers, and we talk about nursing in terms of the opportunities for these caregivers. There's 300,000 regulated nursing professionals in Canada. They touch every single patient engagement, community client engagement activity that we have in relation to healthcare. There's 29,000 students in nursing at any one time. And those nurses and those students tell us that they will come to work and join the profession and stay in the profession because they want to provide excellent patient care. And they are looking for places to be able to carry out their values, carry out their mission. And we also see it very often when things aren't working in terms of the Canadian Nurses Association. So there is oftentimes, when we hear through surveys, etc., moral distress related to nurses who are not able to provide the standard of care that they would like to provide. And so one of the things that we're just working on right now, as an example, is working with CFNU to look at a safe staffing toolkit. And that's a good thing. It helps nurses at the bedside look at ways to identify problems and move forward when they have identified problems. But isn't that the wrong way of dealing with things? Wouldn't it be better to look at our caregiving environments and be able to say, what is the standard and how do we achieve it? One of the things that I think about most when I think about the magnet status is I think about what is the word or the three words that come to mind in terms of looking at magnet status. And it really is, to me, three things: leadership, and leadership not only from the individual nurses who want to do the very best care and how are they going to provide that, from the nursing managers and those that are mentoring new and practicing nurses, the senior leadership in organizations such as Mount Sinai, and the CEOs of the organization. And it really is about leadership, managing a culture, including investing in a culture to be able to support the care that we all want to support. Registered nurses have some of the most regular and direct and consistent interaction with patients than other providers, and we know that. And RNs know very well the strengths and weaknesses of the current practice environment, and we hold, all of us, innovative ideas in terms of how we can improve the practice setting. We do it every day. We have great abilities to look at an environment, be able to assess a situation, and adapt the situation to the needs of our patients. So we are well positioned to look at using the best evidence, looking at our environments, and taking it forward in terms of the interests of our patient. These positive patient and nurse outcomes mean that employers and the healthcare system as a whole benefit from a greater workforce stability, improved efficiency, and, as we've all heard from our speakers this evening, less costs. It's an investment that all governments should be pursuing by helping our healthcare facilities achieve this designation and the stamp of high quality, safe, and effective care. I think one of the challenges that we need to think about as we move forward is not only the supports that we need to put into place for our practitioners and our leaders and our decision makers, but as what you were talking about, the most fundamental challenge I think we have as a healthcare system and as a nursing healthcare system is looking at those metrics. Looking at how we can report on the difference that quality nursing practice makes on patient outcomes, and having those measurement tools and being able to measure that. Because in all of your comments tonight, using it as example, all of your statistics that talked about the results of all of the steps that you have put into place has completely, it just tells the story in those several sentences, doesn't it? But the work behind that is profound, and the preparation behind that is profound, and the investment and the moving forward over many years is profound. One of the things that the Canadian Nurses Association can do to help organizations as they move forward in considering whether magnet designation and status is right for them is we have two main functions at the Canadian Nurses Association. One is professional and policy and advocacy in terms of what can nurses do to contribute to a sustainable not-for-profit healthcare system. And the other is tools and resources and subject matter related to professional development. So we have a number of platforms and a number of resources to be able to provide input into those organizations that are looking at considering magnet status, whether it's position statements, toolkits, webinars, RN prescribing frameworks, etc. But I think one of the major tools that we have available to us is our CNA certification program. And this is a well-known, evidence-based, high-stakes exam process that we've had for over 20 years at the Canadian Nurses Association. There's 20 certification exams that are provided in both languages every year to nurses across the country who take up the challenge of being able to demonstrate their expertise in their area of specialty. There's currently 18,000 CNA certified nurses across the country, and it's a mechanism and it's a recognition of the value that the individual places on being able to demonstrate competence that a nurse has in her area of specialty. And so we're quite pleased to be able to have this program, and we're expanding it. And one of the things that we're doing is expanding it with the D'Souza Institute, who some of you may know about in Ontario. And we're looking at working in partnership with D'Souza related to the oncology certification program as well as the palliative care certification program to look at putting those programs together with the D'Souza programs in terms of being able to prepare nurses in those areas of specialty to a very high degree of competence. And it's interesting, again, that one particular organization in Ontario is using the number of D'Souza prepared nurses that they have as a quality metric, because they know that nurses with a specific level of expertise and preparation does contribute materially to quality patient outcomes. But we can't forget the employer. And so one of the things that are within the CNA certification program that we do is we recognize employers every year who have made a contribution to the certification program and the certified nurses in their organization. And we acknowledge employers for the positive reinforcement and the celebration of certification achievements, for the financial aid that employers have offered to support nurses to take the certification program, to facilitating mentoring and study group opportunities, and for incorporating certification into job requirements, because these are all hard elements that really speak to an organization's commitment. And I thought you'd be interested to know that when we started the CNA Employer Recognition Program in 1999, we asked for a number of applicants to come forward for consideration, and the very first award winner was Mount Sinai Hospital. And so that speaks to long-term commitment, long-term leadership, long-term investment. This is a journey. Magnet designation and status is a journey, and it speaks to a culture of excellence, and it speaks to leadership on behalf of individual nurses, nurse managers, chief nurses, and the executive team. And so I think we've got an excellent example. We've got an excellent program. We have an excellent roadmap, and I think we should all be working to see who's going to be next. Thank you very much.
So my name is Donna Sullivan Havens, and I thank you for inviting me to be here with you tonight. It's actually my first trip to Toronto, and you can bet I will come back. It's been a lot of fun, good people, and great things to see. I wanted to just make one comment that the appraisers, part of the process is you submit documentation, and then if that passes, then appraisers are sent on site. And the appraisers who go into hospitals all over the world, actually, assessing, will tell you that they know when they first walk in. They can just tell if this is really a magnet hospital. I mean, they continue their whole assessment, but they say they know it. It just feels different, the way people behave, the way people treat one another, and so it is about culture. So the magnet concept, how did it come to be? Back in the 1970s, early 80s, there was a major nursing shortage in the States. It started in the States. And usually when there's a shortage of nurses in the States, what happens is people conduct research. Usually that means surveying nurses to ask why they're not happy. This time, a different study was conducted by the American Academy of Nursing, and their goal was to set out to determine what hospitals were keeping nurses. Where did nurses want to work? Where did they stay? And what hospitals had reputations for excellent patient care? So the idea was to find out what was working and then disseminate that so others could model it. And so the folks who conducted this first study, which became known as the Magnet Study back in 1983, were McClure, Poulin, Sovey, and Wandelt, and they published a book called Magnet Hospitals based on all their findings. The goal, as I said, was to identify hospitals that were able to recruit and keep nurses and that had good reputation. So it was sort of reputational. What these researchers did was to poll other nursing admin experts across the country and who were members of the academy to have them suggest hospitals that this group should go look at. So all in all, 165 hospitals were identified. They were surveyed. They surveyed the clinical nurses, the nurse executives, and they interviewed them. And 41 in the end, 41 hospitals were identified as having very high nurse satisfaction, low nurse turnover, low nurse vacancy. And interestingly enough, remember this was in the middle of a major nursing shortage, these 41 hospitals were able to recruit and retain nurses in the midst of the shortage, often with hospitals down the street, across the street, around the corner, who could not attract nurses. Hence, they became known as magnet hospitals. They attracted and retained nurses. So they were sort of called or identified as having cultures of excellence, the measure of goodness, and the gold standard for nursing practice and patient care. So in 1993, a new program was developed to identify, recognize hospitals known for excellent care and excellent practice. It built on the 1981 study, and it was put together by the American Nurses Credentialing Center, a part of the American Nurses Association. This was in '93. And they decided to develop this program building on the original Magnet Hospital characteristics and study to recognize excellence in nursing services, knowing that it went far beyond just nursing, that nurses couldn't provide that excellent care without the collaboration of all of the other persons who contribute to that. So based on, the new program was based on rigorous self-evaluation, peer evaluation, and site visits, whereas the first program was just reputation, and then they went in to survey nurses. So this new program, it is not a once-and-done thing. Hospitals must be reevaluated every 4 years, and they also submit data in between, many, many reports. If a nurse executive turns over, there's somebody contacting them, checking everything out. So it's not a once-and-done thing. So this, there are 12 magnet commissioners, of which I am one. People can volunteer and submit their name to the American Nurses Association to be one of the magnet commissioners or a site visitor. I'm in my second term. When you're selected, it's a 4-year term. The 12 of us represent different facets of nursing. There are several nurse execs, there's a nurse manager, there's clinical nurses, there's a nurse practitioner, I hold the education seat, and there's some from the American Academy of Nursing and the American Organization of Nurse Execs. So there are 12 of us. We also, in those 12 seats, are 3 international folks. So because this is a global program now, they're looking for international folks to serve on this. We have the head of the German Nurses Association, who's a member. We have a colleague from Australia, Veronica Casey, who's a member. And we have a relatively new member from Abu Dhabi. There's a great deal of interest in the Middle East. So what this group does is, once the documentation's been reviewed, once the site visit happens, a report comes to the commission, and we each are assigned a number of hospitals to report on to our colleagues. We all read it, but like a review, we go through it, and then we vote. Once a month, we meet for 2 hours, and we vote on those hospitals that have been visited and reviewed and have been validated to have met the standards of magnet. And then we look at it one last time and we vote. So we meet for 2 hours once a month, and some of us meet for another hour once a month. We meet twice a year in 2 to 3 day meetings. So there's a lot going on, and it's all volunteer, but I can tell you each and every one of us just cherishes the opportunity to read about all the magnificent things these hospitals and nurses and others are doing. So as I said, it's an international credential. It's not a prize. It's not an award. You have to earn it. And the standards are based on research. It's intended to promote quality care in a professional practice milieu. And it is based on outcomes. And I know you talked about benchmarking. There's talk about maybe instead of benchmarking, we should be asking hospitals how they're going to get to 0 for some of these things. So that's the newest thinking. Benchmarking against yourself, and what progress are you making in getting to 0 for all of these nurse-sensitive outcomes that we're looking at. We haven't gone there yet, but I would say it's probably coming in the future. So as of May 2015, there are 410 magnet hospitals across the world. In the US, there are 402. Remember, it started as a US program. In Australia, there are 3. Canada, you can cheer. Yes, you have one in Canada, Mount Sinai. Lebanon, Beirut, Lebanon has one. American University Hospital in Beirut. Saudi Arabia just gained 2 this year. And Singapore has one. And there are many, many countries very, very interested. There's a national magnet conference every year in the fall. And last year, I think they had over 225 representatives from other countries to come learn about it. So, congratulations to Mount Sinai again. Yes, part of being the chair means I get to call all these hospitals that have been approved once a month. And I have to say it is the highlight of my day. And usually there are auditoriums absolutely full, and the cheering and the noisemakers and all. It's just an amazing experience. So when we reviewed Mount Sinai's, I'd just like to quickly tell you, we identified 4 exemplars, 4 things you were doing exceptionally well that we wanted to tell you about. One thing that impressed us was the programs you have in place to transition new graduates into the practice setting. Also, the way you establish partnerships to address the healthcare needs of your community. And the way you promote participation of nurses in interprofessional collaboration to improve care. And finally, we were most impressed with the non-discriminatory climate that you have created. So for all of that, I say congratulations to you, and it's been a great pleasure to get to know you. Thank you.
Thank you very much to the panel. At this point in time, I'd like to open it up to members of the audience if there's any questions. Ruth?
Congratulations, Mary Agnes. I just want to learn your secret of success in terms of engaging interprofessional partners.
So I'm not sure if everybody heard the question. It was her process for engaging the interprofessional partners. Is that what you were asking? Okay.
And that's a great question, because I think one of the challenges, as I said, especially in our environment, there seems to be a sensitivity around standing up for your individual profession. And while we absolutely work in an interprofessional environment, and as you heard, we were acknowledged for having a great interprofessional environment, I don't believe, and at Mount Sinai, we don't believe that having good interprofessional collaboration means that you subvert your own identity. And so the way in which we've done that is by encouraging all professionals to find their voice and to be strong. We touched a little bit here on Magnet. It was a 10-minute talk. Obviously, 3,000 pages in 5 years is more than a 10-minute, reflection on the process. But part of all of this is identifying what a nursing strategic plan is going to be. We chose not to do a nursing strategic plan. We chose to have a patient services strategic plan. That meant that was nursing and allied health. And you have to remember that Mount Sinai is probably one of the few hospitals that still has a traditional department of nursing. But we did this as a group of healthcare disciplines and came together. We had a 3-day event. We went through this whole process of gathering stories from all our health disciplines, professionals, to talking about what they were like at their best, what that looked like. We created a strategic plan, a direction, and that really guided our journey. That was also the background and the impetus for then developing our professional practice model. That's an interprofessional practice model, so it speaks to all of our healthcare professionals. And then we developed a shared governance structure that allows us to operationalize the outcomes of our model, and that's also interprofessional. So the way in which we did it was from the beginning saying we're all in this together. Yes, nursing is doing Magnet, but it's no different than lab accreditation goes out for lab accreditation, and the rest of us have to pull up our socks and meet their standards in order for excellence in patient care. And this is what it was all about. We marketed it as outcomes for patients. It's, as I said, it's about nurses, but it's not about nurses. It's about all of us working together, and it really is creating that environment where I tell you, our biggest cheerleaders and supporters, other than ourselves, were our physician colleagues. It was absolutely phenomenal. During the site visits, one of the forums that they have is they ask physicians to come forward, and the appraisers meet with them separately for a 1-hour period to talk about the quality of nursing care and practice. And again, our appraiser said, well, they've gone to some organizations and sometimes one physician shows up, or 2 or 3. We had 26 physicians in the middle of the day at 2 o'clock in the afternoon. They canceled clinics, they reorganized rounds, they stopped what we were doing. Our chief of surgery, made sure he wasn't doing surgery that day, and they came forward and they were so committed. So as I said to Linda, I wish I'd brought the photograph or the video of the actual auditorium, because it was wasn't just nursing in there, it was the entire organization, and everybody felt it. So it was so heartwarming. And our physician-in-chief right now, Dr. Gary Newton, said to me, "We should do this every day." I said, "I don't think so," but it was really something that everybody felt. One of the other venues that we had is we were obligated to advertise that we were undergoing magnet designation, and so you advertise that publicly because anybody who has any comments about Mount Sinai is welcome to go and say whatever, and they can email, they can write, they can call, but we also had an open forum in our auditorium, and again, that was standing room only. It was absolutely phenomenal to be there, and it was our patients and families who talked about, our other healthcare professionals who talked about their interaction with nursing and how nurses had changed their lives and done something significant for them. And some of these patients and family members were so nervous and so anxious that they wanted to get it right, that they'd written down their stories and had read their stories publicly. And you cannot help but be overwhelmed by that kind of response and outpouring. And so you just have to do it with everybody. You know, you can't just, it can't just be about nursing, but at the same time, it's about nursing. I know I keep saying that over and over again, but it truly is the way it is.
If I could just add to that, I've been told that physicians really do look for this. They're very proud of this. All of the healthcare providers are, but I've been told about a physician speaking at a national conference. And when he took the podium, he was very excited because his organization had just been designated as a magnet. And his enthusiasm got away from him, and he immediately asked what other physicians in the audience were from a magnet hospital. And a handful stood up, and the entire audience clapped and just congratulated all of them. So it gets contagious, it spreads, and it's good for everybody.
Anybody else have any questions? Leanne?
So congratulations. It's funny, I was at actually Sinai Health System this afternoon with a bunch of docs, and they actually used the word magnet. We were talking about antimicrobial stewardship, nothing related to it, but the notion of magnet is very much part of your lexicon, which is fantastic. So what's next? So what is it that you have to do to maintain the designation of a magnet hospital? So what is the next step in your journey?
Yeah, that's an excellent question, because as much as you like to say, "Oh, great, got there," it really is a journey. So we designated under the 2008 criteria. There's a new set of criteria, 2014. So ever more rigorous standards, more nurse indicators, are required to benchmark now at the unit level. So we benchmarked at the organizational level. We had we reported at the unit level for improvement, but overall we were evaluated at the organizational level. So now it's at the unit level. The requirements for more indicators is stricter, and in fact in Canada we're not able to get the Canadian data that we need. So one of the things that we've had to do is we've had to become members of the NDNQI database, because that's the only way that we're able to get data and compare ourselves at a national level, in this case at an international level, because to my knowledge we're the only Canadian hospital that is part of the database. And so again, we've heard, you know, my colleague Anne here from the CNA. You know, in nursing, we've been talking about nurse-sensitive indicators and having good databases in Canada for at least 15 years that I can remember. It is a challenge for us, and I think whatever the issues that have existed, we need to kind of get over it and move on, and start where we can. And partner with CIHI to really get those outcomes, start reporting them, putting them into the hands of nurses, and really for the benefit of our patients. So for us at Mount Sinai, what's next is the continuation of where we are. We will be, next January, we have our first report that goes in. 2 years, we have interim data that we need to continue to show that we're outperforming our benchmarks. 4 years from now, we undergo redesignation, so it doesn't stop. It's a continuous process for us. But I think as a nursing profession, we need to all think about how we continue to articulate our contribution in the system, and in order to do that, we need to have the data to be able to do that. And
sorry, I should say a second part too is how, as we, as Linda McGill-Hall and I, we're very much interested as researchers, how can we help you advance the knowledge on the new innovations and improvements that are required?
yeah, and thank you for saying that, because. Well, and so in the next iteration, and this one, and you know, Donna, you can probably speak to this better than I can, but my understanding is that it's more heavily weighted your first time around on the transformation of leadership, structural empowerment, and exemplary professional practice. We will have stronger requirements for more outcomes, and research will be even a stronger part of that. So it doesn't stop. We're continuing to always build and grow and evolve the model, and now we're Sinai Health System. We need to think about what our model looks like as a system, not just as a site. So it doesn't end. It's a continuous journey.
Dave at the back, and then Ruth.
Could I just add one more thing, Linda?
Sorry, yeah, Donna.
It is about outcomes, and when the program began, the new program, it wasn't nearly as heavily angled toward outcomes, and now it really is, and I think we're going to see even more. And they have to provide clear demonstration that the nurses are doing research and using evidence-based practice. They submit research tables, and they have to show what research projects their staff are involved in. And are they publishing those results? Are they presenting those findings? So it's about dissemination of good research. Really heavy. So yes, they need to partner with folks like you.
Dave, and then Ruth.
Hi there, everyone. Sorry, I'm Dave. I'm in the back of the room, and I'm the voice of everybody joining us online. There's 17 nursing colleagues watching our live cast right now. And just a quick reminder, if you have any questions from the auditorium, just give us a moment to get the microphone to you so that the webcast attendees can hear your question as well. But I have a question from Sean here, who's wondering, are there specific differences or considerations between academic teaching and community hospitals when pursuing magnet certification?
No. They all have to meet the same standards. Some of them meet them differently. Many of the academic health centers have more robust research tables, for example, but the community hospitals are being incredibly resourceful in the way they're partnering with faculty and schools of nursing, et cetera, to bolster their research output. So, no, they all meet the same standards.
Excellent. Thank you.
Okay. Ruth, and then Judy.
Actually, I have two questions.
Okay.
One is about the data. We have HOBIC. We basically integrated HOBIC into our electronic health record, for example. Can we use those data? Is my first question. And my second question, probably directed to Donna, is about the Homeland Security things. If we send data to the state, will the data also affected by the Homeland Security at the U.S.?
I'm not sure I understand that. Can you tell me more?
Well, from what we understand for some of the data sets, for Homeland Security, which I'm not too familiar, so that's why I'm asking the question, will one day if certain events happen that the data we submitted being scrutinized, or any issue about needing to open up the database and things like that, or no?
I'm not aware of anything like that being discussed or happening.
Oh, good. That's a very good thing.
But I'll follow up and ask about that.
Mm-hmm. Okay, thanks.
So maybe I can answer those questions. In terms of HOBIC, the data that's required needs to be at a national level. Mm-hmm. So any database that you're part of needs to be benchmarked at a national level. If it's not at a national level, then it's not it's not sufficient. So that is one of the challenges that you face. For example, when we have, I mentioned our VAP outcomes, we used VAP, but that was one area that we were cited because it's a provincial database. It's not a national database. And so again, when we're looking at redesignation, we need to have national, international level. You have to benchmark yourselves at the highest level possible. And that is one of our challenges in Canada. It's very difficult to do that.
I would have to say all of the international hospitals, those who are magnets and those who wish to be magnets, that's probably the greatest challenge they're facing, finding those international databases.
And then in terms of the data submission, it's de-identified, anonymized data, so it's there's no risk in terms of patient confidentiality or accessing any of that information. You're not reporting anything that's of a sensitive nature. But it does give you access to not only your outcome data, but then it also allows you access to the structures and the processes of care. So it is a very unique database, and it will allow us, I believe, in the future to do more than just do benchmark comparisons, but to actually start to look at some of the drivers of how we compare to other organizations.
I think Anne Sutherland-Bowl has a comment, and then we'll ask Judy for her question.
I have two questions for Donna. One of them is, what is the relationship or conversations between the magnet hospitals and the Joint Commission on Hospital Accreditation in the States? And secondly, with the exemplars that you find from organizations, how do you disseminate that information so that others can benefit from best practices?
Great questions. The first one was
the relationship.
The Joint Commission. Yeah. There's been talk for a while on working with the Joint Commission to ask them if they would accept magnet recognition in lieu of organizations having to show other ways that they're meeting Joint Commission standards. And that's something that people feel good about on both sides right now, but nothing has happened so far. But I will tell you that the Leapfrog group in the U.S. that looks at patient outcomes gives extra credit if you have magnet certification in their rankings. The U.S. News and World Report magazine that ranks hospitals in the U.S. also gives extra points, extra credits toward the ranking if you're a magnet hospital. So groups are starting to see that this has application for reasons like that.
And then best practices.
And
the best practices, how are they disseminated? We do identify exemplars when they exist every time we review an organization. They're not disseminated at the moment, but I think they should be. We've talked about the fact that in a way that wouldn't divulge recognition of any particular organization, this is a great source of looking for best practices on in a particular area and disseminating that. So we're urging Magnet to think about doing that.
Okay. Judy, you had a question?
I think my question is related in that, you know, congratulations, you're obviously a fabulous model, and I would anticipate others approaching you for outcome measures, process models, and how are you going to handle that on top of everything else? I think you'll have lots of requests.
Yes, yes, and we have started to get requests, and so again, as a magnet organization, this is part of what we've signed up to do. So we very much see it as part of our obligation to be able to share the journey and encourage excellence in care for all patients and families in Canada. So we welcome the challenge. Interestingly enough, we've had a call from colleagues in the Philippines who are looking at becoming a magnet organization, and they're very enthusiastic and calling us and wanting to come for a visit and wanting us to go down there. So I'm not sure where that's going to go, but there certainly is interest in that.
And that's actually typical, that the magnet hospitals do get a lot of calls internationally and within their own countries. I know that there's, throughout the states, different states like Pennsylvania, North Carolina, those magnet hospitals have developed consortia where their leaders might meet once a month or twice a year, and they're opening it up to others who aspire to be a magnet. So there's a lot of mentoring and helping and sharing that goes on.
Barb, you have a question?
Thank you very much. I want to add my congratulations as well. And my question is about the strategies you've used at the bedside or at the unit level to enable nurses to study that data, to analyze it for their own units and come up with the strategies to make their care better. And the subtext is, has the nursing care delivery model changed in any way to allow those activities to happen?
Great question. I don't know that our nursing care delivery model has changed. It hasn't. We're at the present in all our in staff and have been for some time. We changed very much the way in which we looked at our professional practice model and our governance structures. So, many organizations have unit practice councils. We had a mixed bag of those when we began. We certainly worked very purposely to ensure that every single unit had a nursing practice council, that the members of, that the chairs of those councils came to a coordinating council. The coordinating council is chaired by myself and a staff nurse. So right from the beginning, we were sort of building in accountability structures. So it wasn't just about, here's your data, what are you going to do? We were building in accountability structures to ensure that nurses were feeling like they own the data. But then we also provided tremendous amount of professional development and support. And so there's a whole program that goes behind this. It was everything from teaching nurses how to read data, to understand what a benchmark is, understand what an indicator is, understand how to read a graph, how to read a run chart, teaching PDSA cycles, teaching, we partnered with McMaster University in the evidence-based practice program there to come every summer and hold a week-long training program for our advanced practice nurses so that they're up to speed on evidence-based practice and understanding how to apply that and how to translate that at the bedside. We didn't only do it for nurses. Going back to the question of how do you include everybody, we did it for nurses and for health discipline members. And so it really is a program of everything you do. You include your frontline staff in that, and it just becomes a part of who we are and what we do. But there was a tremendous amount of education and training and support that went into doing that. And so, for example, one of the things that we did is we developed this new knowledge and innovation framework, and it was teaching nurses the difference between quality improvement, evidence-based practice, and research. We actually had a 3-year program that took staff nurses from how do you come up with a question about practice. What's that question? Is it a quality improvement initiative? So we taught PDSA cycles, so they had to find something and they had to use a PDSA cycle and they had to come back and report on that. We, during Nursing Week, started a bedside to boardroom poster display that aligned with, it just happened that aligned with ECFA when the legislation came out. And so we talked about, the importance of having that connection throughout the organization and how nurses contribute to quality patient care. And so we did that, and so the first year we said, come with your posters. And I'm telling you, we got 3D posters, we got construction paper, we got whatever we got, it didn't matter. Whatever they brought forward, and we had a display, and they talked about their posters, they talked about what they had done. We gave an award. The second year we moved that into, now you have to have an abstract, you actually have to have, you can use a PowerPoint presentation, you can, a little bit more, move that up a little bit more. The third year we said, now you actually have to have an abstract. You have to have a presentation-ready poster, a professional poster developed and presented. And so every year we've upped the bar. Natalie's taken the lead on that work, and she's done a phenomenal job. And so the nurses look forward to it, and they're now, coming forward. They're used to, so you have 21 units where nurses are practicing, and they all come forward with a different presentation around work that they've done that year to improve patient outcomes and the quality of that work. Our hope is that now they have posters that are ready to go out to presentation at a conference that they can take forward and share with their colleagues. So it's that kind of sort of thinking very purposely about how you bring staff along. That's why it takes 5 years. It's why it's not just something that you fill out and say, yeah, we're a magnet now. It really does take that ability to think about how you're going to bring staff along and empower them to be equal partners at the table. And then you use other synergies. So CNA, absolutely, one of the things that you have to do is you have to set educational goals and staff development goals for your department, for your nurses in the organization, and you set those goals and you have to show that what you're doing to achieve those goals and how you outperform what it is that you've said you're going to improve. And so for us, one of the things was the percentage of nurses that had CNA certification. So again, you know, we're like every other, I'm sure we're not different than any other organization here. We don't have really good, robust ways of collecting that data. So it's literally going out to the front line, asking people to fill out their forms. Do you have a designation? Do you don't? What's your highest level of your education? Collating that data and then saying, okay, now what are we going to do? We're going to increase by 5% every year. We're going to set aside some money to help support nurses in pursuing their certification. We're going to provide educational opportunities. Some it's working groups, some it's supporting them to go to other courses that they can get that support, and increasing the percentage of nurses that have CNA designation. So it's working with the organizations that you have, the supports that you have, the structures that you have. We just got designation with as a BPSO site. We partnered with the RNAO, as many organizations have. We're not unique to Mount Sinai at all, but we knew we needed to really make that evidence-based practice piece robust in our organization, so that was a really good way to do that. And so a lot of this it's not all net new. It's about looking around in your environment and what's happening and how you start pulling all of that together into a framework that really supports nursing practice and nursing environment.
Any other questions from the audience? I'm wondering if any of the nurses from Sinai want to add any comments. Go ahead, Hilda.
And to further what Mary says, we several times a week.
I think the mic is coming to you.
Training frontline, really making us feel that we own it. We really do feel, every one of us, that we own Magnet. And one thing that we have done is having huddles. We have huddles several times a week, and we can say honestly, okay, we have to improve. These are nursing sensitive measures. This is not up to just what we want yet. This is what we're going to work to improve. And the Health Quality of Ontario had a conference not too long ago, and they talked about organizations in which they were not afraid to say we are not perfect, that we can make mistakes or not be up to par, and that it's okay that we can admit there is certain improvements we have to do. And process improvement, that we can improve process, and that we can, yes, we're not perfect, as Mary Agnes said, this is just a journey. And so we are on a journey. We're not ever going to be right at the top where we can say, yes, it's finished. We can. And the huddles we have really brings everybody at the front line feeling that we own Magnet. And so we talk about the outcomes and nurse-sensitive outcomes and what does have to be improved yet. And patients really have very high patient satisfaction with us. Every single patient we have gets on patient satisfaction survey, and those are shared during the huddle. So we are on board all the time.
Thank you. Any last minute comments from anybody on the panel? No? Well, I'd like to take this opportunity to thank the panel members. You were all wonderful. I really appreciate your coming here, and thanks to Dean Johnson for sponsoring this event, and Jane Merkley and Joseph Mappa for coming, and thanks everybody in the audience for attending the poster session and this event tonight. Really appreciate your coming, so enjoy your evening. Thank you.